Very important story where India is deploying AI in its battle against the world's worst tuberculosis epidemic, where over a quarter of all cases, unfortunately, are in India. India has invested millions in a national campaign to curb the disease, reducing its incidence by 18% since 2015. But diagnosing and treating the disease is a complex, lengthy process, and which is why now there's an Indian non-profit organization, that is Wadhwani AI, which has developed a suite of AI-powered tools to assist health workers detect undiagnosed cases, decide on treatment plans, and prevent people from dropping out of treatment, most important. And working with the Indian government and the US Agency for International Development, the organization is currently piloting these tools across the country. Let's get in a representative. In fact, the CEO of Wadhwani AI, Shekar Sivasubramanian, joins me on the show to really understand and decode for me how technology can find solutions that medical practitioners around the world, around India, have been grappling for decades. So explain to us the significance of AI and the role it can play in terms of really becoming solutions and providing those solutions that medicine is searching answers to.
Certainly, thank you. AI as a technique, AI is one of several technology-oriented techniques that can be integrated into any system, any ecosystem. Particularly with the health ecosystem, it's a very good idea to make sure that you integrate AI in a very intelligent manner into the system. So when you speak about TB, there are multiple aspects within the ecosystem in the manner in which the disease comes, it spreads, it can be controlled, and it needs to be managed. AI, as you know very well, offers what we call point solutions. It offers intervention at every stage. And the way we have analyzed and understood the problem with respect to using AI in such an ecosystem is that if you do it in multiple parts of the ecosystem, the cumulative effect will be quite significant. So I'll give you some example. The first area is to just make sure that you can capture or catch what is popularly known as the missing million, or what is called as the individuals who we need to get into the treatment regimen. And so one of the solutions we have, and it's a very difficult one, is to capture TB patients using a cough signal. Now, there are two ways you can implement this. One is in a facility setting, which we were very successful, but to do it in a generic community setting is a complex and difficult problem. So we are working with the government of India, the CTD, to roll this out pan-India. So This is an example where we would like to find out if a person has TB, and then if they have it, then you can move them into the cycle so that they can start getting treated. The second, which you mentioned, is what we simply call loss to follow-up. And essentially what that means is when a new patient comes in for treatment, we need to give them, say, a risk score between 0 and 100, a higher score meaning a greater propensity to not follow the medication. And if they don't follow the medication, three very adverse impacts happen. There's mortality, there's a higher cost for treatment, and there's a possibility they'll spread the disease.
That's a very important point, sir. So let me just come in there, because this is important, but I also want to sort of make it in a manner that a lot of our viewers also understand, and a lot of viewers are not that savvy in terms of technology. I am not. So I'm going to just ask you simple questions in terms of how significant this is. First and foremost, in terms of your response so far, you've been dealing with Government of India, and so far, what has been the response like to this program in terms of the success, in terms of the scale, or the problems that are very unique to India that you need to find solutions to?
Multiple perspectives. So the first is that we started on this mission with the Government of India before the wave of Gen AI, etc. So this is your classic AI-related problem solving. And we were with the government from 21 onwards. And the government has been a very effective partner. In other words, if we want to, our mission as an institute is to scale solutions in India. And the only way you can do that is to really be part of the entire ecosystem that actually solves problem at the ground level. And so the Government of India, particularly CTD and Ministry of Health, all the ministries, we work in multiple ministries, agriculture, education, health, we are present across. There are multiple things. One, there is a significant recognition that there is a possibility AI will solve problems. Then they're looking for partners who can provide them credible solutions on the ground. This is away from instances where we kind of talk about AI. The idea is we actually provide the solution that can be used. In my personal opinion, there is nothing more important in India than actually creating solutions that can be experienced and used. AI is one subject that you will learn by doing. So the more we do, the more we implement, the more we learn. And by its very construct, it will get more data. When
Yes.
it gets more data, it gets more intelligent. So how do you solve that conundrum? You work with the government.
Indeed.
They did the data collection for us. They help us reach out to all the states, etc.
Yes.
We bring the technology pieces. We have to integrate with their programs. We have to take the responsibility of making sure our AI is credible, it's
Yes.
real, it's responsible, and it's in pace with the pace at which the government can adopt
Absolutely.
it for an effective solution. You cannot just get excited. You have to work
Absolutely.
within the construct of what can actually happen in a country as diverse as India.
As diverse, as
Another
large as India. I'm afraid I have to interrupt you there, Mr. Sivasubramanian. Thank you so much for talking to us about what I really hope is probably one of the most successful stories in terms of how AI can be used to solve some of the most complex problems that mankind faces. Thank you so much. I'm out of time in this conversation, but wishing you the very best in this program.